Hi, I'm Dr. Amy Music from Washington University in St. Louis, where I direct our multidisciplinary cutaneous lymphoma clinic. Today I'm going to talk about our group's paper entitled Current Measures Are Not Sufficient, an interview-based qualitative assessment of quality of life in cutaneous T-cell lymphoma. Most dermatologists are aware that cutaneous T-cell lymphoma, or CTCL, is a rare subtype of non-Hodgkin's lymphoma. It involves malignant T cells that hone to the skin. The most common types are mycosis fungoides and Sézary syndrome. We can see very different clinical presentations ranging from patches and plaques in early stage disease to tumors, ulcerations, and erythroderma in patients with advanced stage disease. This disease has a profound impact on patients' well-being, their daily function, and their overall quality of life. We wanted to see whether surveys that we as clinicians use to measure quality of life ask the right questions for these patients. In other disease areas, like atopic dermatitis and psoriasis, there's a specific effort to identify the most important outcomes for patients that includes quality of life, and then make recommendations using those outcome measures. We don't see an effort like this for CTCL, so we wanted to give our patients the opportunity to tell us about their experience in their own words, so we could look at the quality of life surveys that we already have and evaluate whether they're actually capturing what's important to our patients. We interviewed 18 patients across all stages of CTCL. We developed our interview questions from topics identified in clinic and from literature searches. We coded our interview transcripts and were able to interpret our data based on the frequency of our codes. Our main findings included patients describing the impact of their symptoms, which includes itching, pain, skin flaking, problems with sleep, and how these symptoms impacted their normal life. They talked about the psychological impact of these symptoms, feeling self-conscious, embarrassed, depressed, and hopeless. Even treatment was a burden for these patients. We found that these patients had really specific concerns and priorities that distinguished them from other patient populations. And when we looked at the quality of life surveys that already exist and are used in these patients, we saw our patients' concerns aren't actually captured in these surveys. Moving forward, it is really important to incorporate these CTCL-specific quality of life concerns into a very specific survey that actually captures our patients' experience. This study is relevant to any dermatologist that cares for these patients and any patient that has to live with this disease. Being able to capture what's actually important to our patients and the aspects of disease that really affect their quality of life will allow us as providers to focus and direct our attention and therapy on their real needs.